Hi, and here on the item we have from Invacare the Soft Tilt in-bed management system fitted to the Etude Plus bed at the moment. And with me today is Martin from Invacare, who's going to take us through this amazing product.
So the Invacare Soft Tilt is a product which combines three different elements, which at the moment is the only product available which does. It will cover pressure care, it will cover positioning, and it can also assist in the reduction of care packages from dual up to, or double up, should we say, sorry, to single. The way it does it by fitting to the bed is by elevating one side of the patient or the other, alleviating and reloading different pressure zones, but also keeping the patient central in the bed or in the position where they started from. So at the moment the bed, or the Soft Tilt, is in a manual setting, and there are two settings available, both manual, where it can be used on the handset itself, and in program, where the program can be very specific to the individual patient's requirements on pressure care. So it's not necessarily just inflated or deflated as some products on the market are. It can be very specific to maximise the pressure relief ability for the particular patient on the bed at that time, and can be changed at any given time should the patient improve or decline in their requirements. In manual setting with the handset itself, you can see it's quite a simple handset. We have up and down for both panel sides or sides of the patient, and we have an auto sort of element that will raise the panel to a certain level. For myself, I would always use the manual and always advise carers to just use it manually so they can gauge the positioning of the clients changing. If it's going to, they can change body position if they need to, but 9 times out of 10, we're not going to have to do that. So with the manual mode, what we'll start to do is elevate both sides, and we have a left side and right side of panels, and it is as the patient lying on the bed, not as the carer looking at the bed. So if I press on the left-hand side, I would see the left-hand side of the patient raise and the right-hand side of the patient rise alternatively. Okay, let's take that back to level. With a manual transfer, we could be looking at a couple of things here, but predominantly a carer coming in the morning and wishing to transfer the client to a commode or a shower chair and to apply a sling, and how easy we can make that for them. And a lot of it is about keeping the patient or the carer, sorry, as hands off as possible to improve the dignity that the client actually experiences. So if the client is able to assist in their positioning for a manual roll in regards to opposing arm to shoulder, cross at the thighs or the ankles, whichever you prefer, and look in the direction that they'll be elevated, we can then commence the movement of the equipment. If I press the up on both panels, and what that would do is there would be a mattress on top, of course, and that would compress the mattress around the lumbar area of the patient on the bed. And it gives them security, it gives them that warmth in the sense that they're being supported before being elevated on one side or another to a higher angle. And it helps endorphins actually relax them and move forward in the processes. So it's really good from a neurological point of view, whether that be dementia care or other neurological reactions, as well as in regards to seizures and the reductions or in the chemicals through the brain to reduce that possibility. Okay, with the what I call the hug in place, with the elevation on both sides, I could continue rotating or elevating one side of the patient either towards the safety rails on the bed, which should be up on the opposing side if we're single care, or to myself, depending on what I'm doing. With the client rolled to the left side by elevating the right panels, it would allow me as a carer to then prepare the sling, folded or rolled, and come down the back of the patient without hands on at this stage to quite a depth that I would not need to complete a roll to the opposite side. Okay, so when I bring the system flat after that place, the sling should be accessible for me to just pull through from the other side of the bed. And the way that I do that is with the hug already in place, as we just explained earlier, so that the mattress is nicely compressing into the sort of lumbar area of the patient, giving them some relaxation. We can then elevate the side which I need to turn away from, and this will go up to a maximum of 80 degrees. So depending on client size, in regards to weight or where the weight is on the client's body itself, then this will determine how much the carer may need to elevate that panel to get the better access to apply the sling. Without a mattress on, of course, what you don't see is the nice curvature that the mattress will have over the panels. You're just seeing an elevated metal section. But hopefully what you would see is the ability when playing with the height of the bed, so as a carer I'm not overstretching and not overreaching. That with the mattress in place and my hands have been off the patient at this particular time, okay, I have the sling behind and I can then come down the mattress pressing into the foam or the cells of the mattress itself, down below the midpoint of the spine, way below, and then unravel the sling as I do so underneath the head and underneath the legs to the thigh, depending on the design of sling, of course. Okay, an element to then bring them flat can be one of two things. We can do the opposing button to lower, or we can just press on and off on the main control box and the system will lower the panels themselves. With the sling already past the midpoint of the client's spine, we bring them flat. I myself as a carer would be on the opposing side of the bed at this stage, and I would probably have access to the sling as far down as we'd pulled it and to just unravel and ready to hoist. It's very much a lot more hands-off experience, both from a carer's perspective, of course improving the experience for the client or patient in the bed. So we'll go through the control box for you, which is the element here on the end of the bed. When the power is to the control box, you will see 3 dashes, and it's just like a standby mode in that sense. Nothing is active, nothing's working at this present time until the carer comes along to select what they need to do. So if, for instance, we were having the program run and we're coming for a morning visit, what we can do to make the handset live and for the carer to then proceeding either applying a sling or a bed bath, so on and so forth, would be to press the on-off button, allow it to go to standby mode, the program and the system will go flat, and then we press and hold the manual button in the top right corner here for between 3 to 5 seconds, and once it's live you get the 2 O's in the display itself. The handset is then a live active function and remains live and active until someone comes along to either change to a program mode or to completely turn the system off itself. So if the client is bedbound more through the day, they are able to assist in their repositioning for comfort and pressure care by utilising the handset themselves because it remains live and does not have any sleep mode. So if I then go to the handset and start to do the hug, which will be both buttons up, you can see the panels will raise, the handset is live, and the handset will remain live, as I've mentioned. If a carer has come to an evening call, and what they need to do is stop the program if it's been running during the day, and they need to obviously apply a sling for toileting, whatever that may require, they can come to the system itself, they can press the on-off button here. Whatever is happening with the mechanism on the bed, it will drive itself flat under the controls of power. The handset is no longer active, so I'll put that to one side, and the system is in standby. The carer, after pressing that to do that, can then press a program function to whichever the programming has been in the system and allow for the system to run continuously, so that we'll now commence on a program which is pre-input into the system itself. You can program anywhere between 3 minutes and 3 hours of a rotation or elevation change. You can program anywhere between 0 and 40 degrees. If you have one elevation side during a program elevating to 40 degrees, the maximum elevation on the opposing side would be 12 degrees. And that's from the fear of anybody sleeping too much on this side or towards face, and obviously the compression into a mattress or pillow.
There we have the Invacare Soft Tilt in-bed repositioning system. This fully programmable system is probably the most advanced pressure care innovation available on the market today. With its almost silent and gentle movement, it slowly turns the person throughout the night without disturbing their sleep, as well as supporting the care staff and their daily moving and assisting procedures during the day. Designed by Invacare and available here on the item today.